The Core 360 belt is the best aid to train the abdominal wall. The Core 360 is a patent-pending, first-of-its-kind training belt that helps you move, breathe, and perform better. We use the Core 360 belt with almost every patient at Winchester Spine and Sport. The biofeedback is second to none, and it's an amazing way to teach proper respiration and can be even used during higher-level movements in the gym. Teaching proper respiration is about as fun as a rash, but with the Core 360 belt, you take all the headaches away. Visit core360belt.com and use the code GESTALT for 10% off all belts, Ohmtrack sensors not included. Again, visit core360, core360belt.com and use the code GESTALT for 10% off. Enjoy the episode. All right, everyone. Welcome to another episode of the Gestalt Education Show. Brett and Taylor, we're here with you today at none other than the Andrews Institute here in Texas. So, Steven's our second time on our podcast, but we're so excited to sit down with the one, the only Dr. James Andrews. So, Dr. Andrews, you're an author. You're basically the Godfather of Sports Medicine, if you will. You've one of the little-known facts that we dug out, you won the SEC championship in pole vault back in the day.
You know, the good thing about getting old is that the older you get, the better you are.
That's right.
That's exactly my days as a pole vaulter are now being eclipsed by the female pole vaulter, so that tells you something. But that was my hobby and my sports, and that's what really got me into sports medicine as a physician. Back in those days, I wanted to combine athletics with medicine, and I knew that I was going to be a doctor since I was a little kid. And the reason I say that is my grandfather, who wanted to be a doctor but never even got through the first grade, when I was being brought up during World War II by him, he kept telling me, "You're going to be my young doctor when you grow up," when he'd rock me on the front porch. So I knew I was going to be a doctor straight away. And then I got involved with athletics in a little small town where you only did two things, athletics and education. So I figured out what should I do to be a doctor and continue athletics. It just so happened my next door neighbor was a primary care family doctor, and he was our team physician. And so I modeled after him. And so I figured out to be able to do both would be to be a team physician, I need to be an orthopedic surgeon. Mm-hmm. So that's what I did, and then I did fellowships in sports medicine and started right off with a very rapid climb to the sports medicine world because I started early and stayed right on course with what I wanted to do.
And you had a great mentor, Dr. Houston, right?
That was unbelievable.
Yeah.
I'll tell you about mentors now, and he was certainly the one that influenced me mostly. But for those of those out there that are involved in sports medicine or any profession, you need to honor your mentors. You need to honor them and pay tribute to them on a daily basis. And if you look in the mirror in the morning when you're brushing your teeth, and the only thing you see is yourself, you're not going to be very successful in whatever you're doing. But if what you see is all the mentors lined up on the mirror that have brought you along and helped you, and you honor and cherish them, you're bound to be successful. Mm-hmm. So that's my emphasis on mentors. And Dr. Jack Houston, of course, was one of the real pioneers in sports medicine in the United States, particularly in the Southeast. He was the team physician for Auburn, and I modeled myself after him, and I still do. Everything we do here at Children's Health and Andrews Institute here, you see me today, I've got a coat and tie on as a physician. Well, that comes from Dr. Houston. And the way we set it up here to make the patient first and to cherish the patient, treat them all special, all comes from the philosophy that I learned from Dr. Jack Houston. So everything that I've accomplished in my sports medicine world, I have tribute back to him. I had some other great mentors too, we can tell you about later.
Well, I think it's a testament to you, too, that you have Dr. Lyle Kane, you have Dr. Dugas. I mean, you have these huge names. They could obviously go off and do this on their own, but they've decided to stay with you in the team. So how do you create such a great culture that these people want to stay with you?
That's a good question. You know, when I say that's a good question, you know, when people say that's a good question, you know what they're doing? They're trying to figure out how to answer.
It gives you time to think.
But the main thing is when you train them as fellows, you have enough influence on them, and you model yourself as a role model, and you bring them along so they respect you. And so that all goes back to leadership. And you have to be a good leader, just like in the military. When you train fellows, you have to be a good leader to try to bring them along, get them to do things that they may not think they could do or may not want to do. But by your leadership, you do that. And my leadership role is to train people that are better than I am. So I try to do that, and you just named two of them that are probably better than I am, and are going to be better than I am as they go into their profession further and further, but they're already better than I am, to be honest with you. But that's the joy of medicine and the joy of the education process that we're all involved in. I don't know if you know it or not, but in my fellowship program, which we started with Dr. Houston in 1974, I now have 650 or so former orthopedic surgeons that did fellowship with us that are out there taking care of high school, colleges, various pro teams all over the United States. And you just named two of them that basically I turned everything over to in Birmingham at the Andrews Sports Medicine Orthopedic Center when I started going down to Gulf Breeze. And then we built this facility, and I'm coming out here once a month or so to sort of manage this place a little bit, which has been very successful too. But you got a good leader here.
Hey, yeah, you did great.
That's really my pride and joy is the legacy that we've established.
Yeah. You have a legendary bedside manner. So, like when I work with players, they always tell funny stories about when they come to follow up with you, and they're like, "He didn't even ask me about my elbow or my knee. All he did was talk to my wife about their kids and all this stuff." And it's really refreshing because in the world of orthopedics, you don't see that often. So was it Dr. Houston who taught you the bedside manner thing? Because you literally have a legendary bedside manner.
I think that comes from our southern roots.
Yeah.
And Dr. Houston was obviously a country-style doctor, and I was too. I was born in a little town, lived in a little town, 4,000 people. So it was just natural for us to sit down and talk. I have one rule that I follow, and it's probably helped me more than anything that I could do from a bedside manner. And that rule says, if mama ain't happy, nobody's happy.
That is so true.
So I
go right to the mom.
Yeah. I get an NFL player come in to see me. He might be 34 years old. He may have his wife with him, baby, this, that, and the other. And I don't care if he's 40 years old or whatever he is. I say, where's your mother? A lot of times mother or the aunt's with them, by the way. Or they call it auntie. Mm. And if they're not there, they sometimes are sitting outside. I say, where's your mother? Get your mother in here. Or I'll say, get your mother on the telephone. Give me her number. I'll call her. You know I've got your son in here. I'm fixing to operate on him. Oh, thank you, Dr. Andrews. And you got him made at that point. As soon as the surgery's over with, I've got their number, and I call them on my mother and let them know I've finished if they're not there with us. But it's amazing in medicine nowadays when we start training these young fellows right out of their residency. They have no idea about the social history. No. They could be sitting in there with a young kid with an elbow problem playing baseball, and they come out and tell me all about the kid. I say, well, his mother and daddy are always with him. A lot of times mother and daddy's with him, and two grandparent sets are with him. Mm-hmm. I say, what does the mother and daddy do? Mm-hmm. They have no clue. They could be two orthopedic surgeons. They could be two lawyers. They could be two whatever. But one of the things that I teach them, and I think that's why they continue to show up as they get out into practice, I teach them, you got to understand who you're taking care of and their personalities, who their family is, who their parents are, to know what to really do for them. Mm-hmm. So the social history is something we have to teach them in a fellowship, to be honest with you. They just don't get that in a residency.
Right. You're considered literally the pioneer in arthroscopy. So can you talk a little bit about what was the beginning of all that? Why you were getting away from open surgeries? I know Dr. Houston was not in favor of arthroscopy, And so you kind of had to take the path less traveled probably at that time. And
well, that was back in the early days, and you're right. That was the one flaw that Dr. Houston had. And I wouldn't call it a flaw, but he was very dominant about who could take care of a knee. Back in those days, the knee was king. And, of course, in our part of the country, in southeastern United States, football was king. And football was mainly knee injuries. And that's what he was really knowledgeable about. And everything done in the knee back then, as I first learned from him, was all open surgery. And I knew that I kept hearing about the arthroscope coming from Japan by Bob Jackson up in London and up in Toronto, Canada. He brought it over from Watanabe in Japan. And my big deal with Dr. Houston, and we were putting on courses for knee surgery, and I had to do all the anatomy lectures. So I was doing a lot of dissections on cadaver specimens at my home, by the way, on the pool table. And so I knew the anatomy. Well, we had 3 or 4 guys in the United States that got interested in the arthroscopy of the knee, and Dr. Houston, he didn't like that because he didn't want any more. There were about 4 or 5 experts in the knee, and they all coveted their little territory in the entire United States. And he didn't want, I guess he didn't want whatever competition, but people sticking a scope in somebody's knee that didn't know what the hell was in the knee. So he allowed me to go to the small lecture series they were putting on with arthroscopy to teach them anatomy of the knee. So I got involved with those guys who were much older than I was. I was probably 35, 36 years old, and I was doing the anatomy lectures. So I was on the very beginning of arthroscopy. I picked it up, and I thought, hey, this is, and it still is, it was a major revolution in sports medicine in the last 50 years with arthroscopy. So Dr. Houston, he didn't like me doing it. We had built a hospital in Columbus, Georgia, a private hospital, and that's where I was working. And he didn't really want me doing arthroscopy. So I had to take my fellow who was training with me, and we moved over to the Catholic hospital, and they opened me up some private little arthroscopy suites to do arthroscopy. So I had to go over there and do arthroscopy without him knowing it. And then I'll tell you one story that was really interesting, real quick. I got a telephone call on Tuesday night when I was first started over there. Dr. Houston said, I got this workman's comp guy. They sent up from Florida to see me, and these guys don't have anything wrong with them. They're just looking for a handout in workman's comp. And I can't find anything wrong with his knee. And he says he can't work. I want you to, at noon tomorrow over there with that scope you've got, I want you to put this scope in that guy's knee and show me there's nothing wrong with him. I said, oh, Lord, this would be something. So it was what we call Happy Wednesday. We operate all day. I was in there with my fella doing a total knee on this old farmer. We got the total knee about half done, and the nurse came scrambling in my room. It was all excited. Dr. Houston was right across the hall. She said, Dr. Houston's already here, and he won't wait on anybody. He said, he and his fella are in there, and they're taking the scope upside down, looking at it. They don't know what to do, and we don't know what to do. You got to come help us. He was already in the room with the patient.
That's awesome.
So I had the prosthesis ready to go with my fella. I said, all right, put it in, cement it in, and I'll go over here and get Dr. Houston under control. So I went over there, I got the scope, put it in the knee, and it was one of the ones we had to look in through the camera, big old long thing, and I was looking over in this compartment. When you see what we call a bucket handle tear of the medial meniscus, it's a whiteout. And I got a whiteout over here. I said, oh, Lord, this guy's got a bucket handle. And I went over here laterally. I looked over here, and he had a whiteout over here. And I turned to Dr. Houston. I said, you won't believe this, Dr. Houston, but he's got bilateral bucket handles in both his meniscus, which is 1 in 2 million or something.
Really?
Dr. Houston went bananas. He was standing behind me. There was a Mayo stand here with betadine solution. He liked to bathe everything in betadine solution, which is toxic. He pushed the nurse out of the way, knocked the Mayo stand over. The betadine went all over the wall. He reached over and got the little blade we used to make a puncture hole and reached over my shoulder and made an anterior medial incision into that guy's knee. Like that. He looked in. I don't know how you can see because you can't see with open incision. Yeah. And I was right. I turned left. I went across the hall. I walked in next door, and I looked at the total knee that my fellow had just cemented in. Something didn't look right. I looked again. I said what his name was. What did you do? He had cemented it in backwards, the femoral
no.
And with a big flange cemented up in the femur. Took me 2 hours to get it out and fix it back properly. So that was my one and only arthroscopy with Dr. Hughes.
That's amazing. What do you think about, that's a great story.
I'm telling you, unbelievable. That really happened.
That is crazy.
What about the lost art of the physical examination? Like a lot of times the new...
See, that's what he didn't want to see happen. People, instead of examining the knee, they just stick a scope in the knee. And even today, one of the things I teach the fellows is you cannot go look at the x-rays and MRIs until you go in and take your history and examine the patient first. So don't try to make a diagnosis based off an MRI. And then when they come out and see the patient and do all that, they want to show me the MRI before I go in there. No, I will not look at the MRI until I get in there and I do my own history. I sit down and prop my feet up and listen to the patient. Let them talk. Tell me what's wrong. If you listen to the patient, you'll know what's wrong with them if you just be quiet and don't do the talking yourself. So then I do the exam. Then we go back and look at all the ancillary studies. By the way, I'll give you a little scientific paper that was done and ask you a question. Y'all are both in medicine. How long does it take an orthopedic surgeon to go in a room with a new patient and ask them what's wrong, and how long does it take the orthopedic surgeon to interrupt them and start talking themselves?
It was 12 seconds, isn't it? Or
18 seconds.
18 seconds, yeah.
I mean, that's just wrong.
Right.
But that's what happens.
Right.
So you have to take your history, talk to the parents like you talked about, find out what they do. Some of these young kids are even professional athletes. I have a board like that board over there, and I have them get up there and write down their entire throwing history when they were 5 years old, all the way up to major leagues or whatever. So we got all their throwing history written in there so everybody can see it. And usually the parents are in there. Stephen knows this. Parents, every one of them come in there and tell you the first thing they do is we protected our 14-year-old son's throwing. We didn't let him pitch much. How in the world did he get hurt, et cetera, et cetera, et cetera. Same story all the time. I have all that on the board up there, all the teams they play with and everything. And I say, well, why do you think why do y'all think he got hurt? They don't know. And I point to that board. And finally bell rings in their brain. Finally they understand why their young kid is in there fixed to be operated on. Mm-hmm. So you have to go through all of that to get to the bottom of the situation. And patients, let me tell you about patients. Y'all need to know this too in your profession. They don't care how smart you are. They don't care how many plaques you've got on the wall, how many diplomas, all the accolades that you've done. They could care less about that. The only thing they want to know about you when they first meet you is, do you have empathy? Do you have compassion? Or you care about them? Beyond that, you start bragging about who you are and losing your humility, and that shuts them off. They don't want to know that. They want to know, do you really care about me?
Right.
That's the number one thing I try to teach all of our fellows and residents that train with me.
And we talk about too, like, you need to be certain as a physician, but you don't want to be cocky. So don't you think that's another attribute that you have, is being certain and confident about what you're doing?
You got to be confident, because professional athletes particularly, they can raid through you in a second. If you're in there hem-hawing around, well, I'm not quite sure. This is something I've never seen before. It may be something you haven't seen before. I don't care how much you've seen. There are things you see almost every day that you've never seen before, but you don't make that blaring statement. You can say, this is really unusual or something like that. But you've got to be confident in your diagnosis and what you recommend. Otherwise, they're out the back door going to another doctor.
Right.
Let me tell you about humility. You talked about not being cocky. Humility is probably one of the most important things for success in any profession. And there's an old saying that says humility is not, let me get it right. Humility is not criticizing or beating up yourself. but humility is thinking of yourself less.
Right.
So it's not you, in other words.
Right.
Humility is not. You don't have to think less of yourself to be humble, but you have to think less of yourself to be humble.
That's well said. Yeah, and I think you learn from your failures, don't you? I mean, like, I know we've all talked about this. I mean, the people you don't help are the ones that keep you up at night. And I think then there's really no bad things because there's this constant learning moments throughout your career.
You know, I went through that last night. I was down here, had a big night. I went to the TCU baseball game, met a bunch of people. I got my ego blew up a little bit, which you got to really, egos are you need egos to be successful, but you don't need a mega. You can't be a mega. What do you call it? Egomaniac. You can't. But you got to have ego to be successful. But you got to control it. But anyway, I spent the night sort of halfway sleeping. But I woke up at 2:00, and I spent the rest of the night going through patients that I've recently taken care of that I hadn't called to check on, what I call my worry list. And that went on most of the rest of the night last night. Now, usually that happens on Sunday night when I really get relaxed and recuperated from the weekend. And that happens to me so that when I get to work on Monday morning, I've got a whole list of people that I should call and run down that have not done that well, or procedure didn't work that well, or they're having struggle with rehab or whatever, and I call those patients. Now, Dr. Houston taught me that. Let me tell you, talking about Dr. Houston, you know what he did? It's hard to get people on the telephone, particularly nowadays. So you can get a text message, but to get them actually on the phone is not easy. And what he did was he'd call them at 5:30 on Sunday morning before they went to church, wake them up. His worry list. Now, I hadn't really done that, but that's sometimes the only way you can find them.
Right.
But I learned that from Dr. Houston. He did that every Sunday morning because he couldn't sleep at all. We'd say we're going to make rounds at 5:30. He'd be there at 5 o'clock. All of a sudden, it's 4 o'clock in the morning we're making rounds. Well, that's just the way he was.
Dr. Andrews, one of my mentors, when he was 90 years old, he said, my best treatment will be my last treatment. And he did manual work, so he was a shadow of himself at that point. But what he was basically saying, I have, 70 years of experience built into my hands and my brain. So as a surgeon, what do you think about that? Do you still have your best surgery still ahead of you, or do you plateau? How does that all work?
Well, as you get older, you narrow your range down to where what I'm doing now is I'm cherry picking the ones that I operate on. And I'm doing the procedures that I've done repeatedly, and I'm still improving on those certain procedures. But I'm not adding a bunch of other procedures that I don't do that regular.
Right.
I've got other doctors doing those. So, you have to range yourself down. And the ones that I'm doing now are basically shoulder, elbow, and knee, and athletes only.
Right.
And I have an old saying that if you operate on the right type of athlete, they can make you look pretty good as a physician.
Right.
And so I pick the ones that I know I can take care of. And yes, I think I did 2 Tommy Johns yesterday on young kids. That's who I'm fixing to call in on in a minute to check them on FaceTime this morning before they go home. But those 2 kids, when I got through, I did this, and I said I couldn't have done those any better.
You're right.
Now, sometimes that doesn't always work, but I'm still able to do what I would call on certain operations I'm good at. But if I get to where I'm faltering, I don't want somebody else to have to come to me and say, Dr. Andrews, you need to retire. You better make that decision before somebody else does.
What do you think about the Tommy John surgery? Is basically a medical marvel, but because of the success, it's so successful, then sometimes like the kids are basically told, it's not like a question of whether or not you're going to get it. It's when you're going to get your Tommy John surgery. So now we have this whole movement in, youth baseball. So, and I'm sure you're doing Tommy John on young kids.
I had the last 2 weeks, I've had 2 that were 14 years old. It's heartbreaking.
Right.
if somebody 14 years old, by the way, you don't know whether they're going to be baseball players or not.
Right.
So they really need to have an operation. If they're not going to play baseball, they don't need to have a Tommy John's to play golf or basketball or something. They need a Tommy John's to throw a baseball. They need it to go up the ladder.
Right.
You take a kid 14 years old and take him out for a year or whatever it is, their development is lost for a while.
Oh, yeah.
And so it's really disheartening to see them hurt. We did a study, by the way, which is interesting for those parents out there. We looked at the group that we did that were in the 8th and 9th grade. No, I'm sorry, 9th and 10th grade, Tommy John's. And we compared that group to the group we did in the 11th and 12th grades. And the 11th and 12th grade group, we were seeing which ones got college scholarships. And the older age group were 5-1 getting scholarships compared to the 9th and 10th graders. So when they get hurt in the 9th and 10th grade, the parents think, oh, he's getting a surgery. He's going to we'll make a great pitcher out of him. That's just not true.
Right.
The reason that some of them actually do better and throw with greater velocity, it's not the surgery. It's all the things that Steve and them do here. It's all the prehab and the rehab they go through. So it's the first time in their entire athletic career where they spent a year in concentrated rehab, making the body stronger, core strength, everything. And that's what, if the Tommy John surgery is successful, and it's not 100% successful, but if it is successful, that's why they're better, is all the rehab they do. And I have another rule that I follow. If most of the time, the rehabilitation after a surgical procedure is more important than the surgical procedure itself.
Well, and there's a trend to try, like especially with ACL, to be like rushing them back on the field. And I think I've heard you say, the stats are pretty telling if you can make them wait a year, but the new number is 6 months. Wouldn't you agree, Stephen? I mean, that's like what everyone
they're shooting for.
They're shooting for that, which seems aggressive.
That's not for me.
Right.
I make a living off of redoing girls soccer players that had a good procedure done, and female soccer players are very competitive. It's the females; they're almost their daddies get involved with them, and they're almost worse than the male.
That's true. Yeah.
And when you got a daddy-daughter deal going on,
pushing,
and sometimes orthopedic surgeons are advertising that you can have ACL reconstruction and play in 4 months. And I make a living off those ones that start early. There's a 30% failure rate in female soccer if you play at 6 months, and that's been proven scientifically. And it drops off at 9 months. It drops from 10% each month back down to 30% at six months. It's really best at 12 months. It's really before 2 years before they really recover. But you can't. You wait 2 years.
Sure. What do you think
everybody's
on Tommy
trying to push that envelope? You see.
Is Tommy John? What's the ideal time you like them out for Tommy John?
9 to 12 months in lower levels and higher levels. When you go with a major league pitcher, he's got to go through all the same routine of step by step, but he's got to go through throwing program, pitching, batting practice, a mound program, pitching, batting practice, playing at a lower level, moving up from low A to double A to triple A to make sure he got his stuff, and then finally to the major leagues where they stop him initially at 30 pitches. I understand the other night we had a big-time pitcher that was throwing a perfect game, and they pulled him at 80 pitches and 1 inning left in a perfect game.
Yeah,
that's because he was coming off something.
Right.
But by the time you do all that in a major league pitcher, it takes longer, right?
Right.
More steps. So a lot of them are a year and a half.
Right.
That's a long time. But professional teams with their players, they've got more time to not rush them. Where they really rush are in college because they only have. Now, COVID's helped us a lot because now we got 6-year guys that they were able to take the time off with COVID anyway. But generally in college, they're all good ones are leaving after 3 years. So what does that give them if they're injured? That means they use them in college, they rush them. And then the same thing in high school. If they're a junior in high school, get hurt, they're rushing them their senior year to prove they can play to get a scholarship. Sure. So they're being rushed. So the best care is in the professional leagues, right, as far as not rushing them. People ask me advice. What advice do you give me about a Tommy John's procedure? It's pretty clear. I always get mixed up on how many words it is, but it's do not rush it. Do not. That's 4 words. Do not rush it, and that's what I tell them. Now that goes in one ear and out the other.
Oh, I can imagine.
Now, obviously, Dr. Andrews, youth sports is kind of your new passion. Not necessarily new passion, but it's been a passion of yours for a while.
Since 2000.
Yeah, and so you have to be pretty proud of your name being on this building in the center right here, as far as if there's someone out here doing some rehab, some prehab, it looks like, and stuff like that. And so do you feel like centers like this are the next step in hopefully, I don't know, not necessarily preventing youth injuries, but helping to curb the pandemic or epidemic that we have of youth injuries?
Well, I'll tell you, this is a crowning jewel right here. I got to brag about the staff here. Stephen was with me in Pensacola, and he was at Gulf Brees at the Andrews Institute. He was our head therapist, and we had our rehab department there well enough established that I needed somebody that knew our system, so we moved him over here along with several other people that are all working here that used to work with me. In fact, it's just like a home away from home here for me.
Yeah.
But the good thing about this facility is that we were sort of able to model it so that we can really get into prevention. And that's what we were working on early this morning over with Steve. And what I'm hoping to be able to do is to eventually have an annex to this whole facility that's entitled Prevention Injuries in Youth Sports, where we teach them sport-specific exercises to prevent injuries in a specific sport at a specific position with a specific injury, male versus female, and have it completely separate of the rehab component. And you're teaching them about prevention. You got to throw performance in there because parents don't really buy into pure prevention. We had to trick them a little bit. So we'll probably call it Prevention and Performance Center. We've got a performance center, as you well know, with Exos over there. But I want to have a separate facility where they can come there and have our PT people working there, and it's all about prevention. So that's what we're sort of moving into that here with Steve right now, and we're doing some things on youth baseball that are completely related to prevention with kids off the different teams. But we've got to get into prevention. You know, in orthopedic surgery, and I speak about sports medicine, the big mistake that we made is we spent too much time putting Humpty Dumpty back together again, and we ignored the prevention side of sports medicine.
Right.
And I've been, since year 2000, beating my head against the wall trying to get everybody interested in prevention, and we made some strides, but we got to deal with coaches, and be honest with you, the coaches are easier to handle than the parents.
Oh, for sure.
The parents think they're doing the very best they can for their kids. They just don't know. I've got my own family, and I've got 12 grandkids now, and some of them are old enough to already been through sports. Some of them are right in the middle of 6th, 7th, and 8th grade. And I try to talk to them about playing in 3 basketball leagues at the same time in the 6th grade. And my daughter, who's had her ACL done by me and played sports, she won't listen to me at all, and none of them will. So when I can't get my own family to understand, it's difficult. By the way, why did we come to Dallas? Well, to be perfectly honest with you, from a selfish standpoint, I had my son and his wife and 2 young kids were living out here, and with his company that they moved out here in the restaurant business. And I knew about how heavy they were in youth sports out here. And I knew also from talking to him about how many kids were playing youth sports, and it was a hotbed for injuries. What was it, over 2 million kids in the metropolitan area playing youth sports?
It's one of the largest in the country.
Yeah. And so I said, man, I better take care of my grandkids out there. So let's see what we can do to build an Andrews Institute. So that's what happened. That's why this place got built.
That's why he wanted me here.
I've already treated get you out
I've
of.
already treated both.
We operated on my granddaughter.
I already treated her.
Soon after we opened this place up, my granddaughter tore a lateral meniscus in her knee in the 7th grade.
Yep.
She was in dance or something. No, what was she doing? I forgot now. One of the sports out here.
Yeah.
And so we operated on her, and she's back doing everything. But
Well, that was something we wanted to ask you about because you've been really good at scalability. So you started in Birmingham. We have Golf Breeze. Now you have this facility. I'm sure there's others in the work. How do you keep it consistent in multiple locations?
you use your people that you train from your central core, and once they've reached a certain plateau with you, then you plant them in a new facility like we did Steve, which gives him a whole new breath in life where he can and then manage it the way that we taught him, and the way that, not necessarily the way we taught him. We expect him to come here and go beyond what we taught him.
Right.
But that's how you do it. It's like tree limbs. And of course, then he's got to bring in other people. We can't just be self-taught or what's the word? There's a word for what I'm thinking about. Inbred. Mm. So you got to mix inbred with new ideas from other places, and Steve's doing that here. And when you do that, you get the best of both worlds, because we always have to be open-minded. You can't be closed-minded, or you'll be in medicine. You'll be behind in 24 hours.
Right.
I mean, it's just a constant learning curve. Even for me today.
When you walk in a place like this, you can feel the customer service is just amazing. So I know
we want that.
Yeah, well, it's there. And I know you were kind of enamored with the Ritz-Carlton Hotel customer service. So yeah, we got our Credo card.
It's in my billfold. I thought I had
it. Yeah, but anyway.
You know about the Credo card?
I've heard you talk about it. It's going to go up in our office.
Yeah. I've got a Credo card we're supposed to carry on our person. I thought I had it hooked here, but it's on my other badge. The Credo card came from when my wife and I would travel a lot, and we had an opportunity to stay in a Ritz-Carlton hotel, which is really, probably the nicest hotel as you can stay in anywhere in the United States. It just so happened that one of my patients from the Atlanta, Georgia area was a guy that started the Waffle Houses, and I got to know him real well, and he also built the first Ritz-Carlton hotel. He's passed away now, but when we go to a Ritz-Carlton hotel, they're always the same. Patient satisfaction, meet you at the front door, everything perfect. So we were at a Dallas Ritz-Carlton hotel, as a matter of fact, and we went up to check in with the gentleman at the desk, and I finally asked him, I said, tell me one thing. How do y'all have the consistency here of taking care of your clientele all the same in all the different hotels and at such a high level? And he pulled his Credo card, which is a little fold-up card you put in your top pocket. He pulled it out and gave it to me. He said, this is why. And it had all his mission and his promises, and where your faculty pledges to do certain things for the clientele, all this, that, and the other. I said, I understand now. And my friend that I'd operated on had developed that. So I took that card and went home, and I just changed it for our facility there in Gulf Breeze to meet the medical standards, and that's how I got that card. No, there's very little ever that you do in any profession that's completely all by you. It's by what you learn from other people, and there's a lot of plagiarism. Is that the word, plagiarism?
Mm-hmm. Yeah.
I'm from a little small town. These big words get me sometimes. But anyway, so I copied that, and it's taken us a long ways. One of the things in that Credo is the Andrews philosophy section, and the main thing about the Andrews philosophy section, that came from a former fellow of mine that spent a year with me, and he sent me a plaque when he went into practice. His name was Yankee Joe. I couldn't ever remember his last name, but he was from New York, so I called him Yankee Joe. I give nicknames to all these fellows, by the way.
Could be way worse. Yeah.
So he sent me a plaque, and he called it Andrew's Patient Philosophy. It had, 10 or 12 things on there that he learned with me. And they were things such as don't ever say anything bad about the previous physician that was taking care of a patient. As a matter of fact, don't ever say anything bad about anybody. And if you can't say something good about somebody, say nothing. The main thing that he says in there is listen to the patient, and along with a whole bunch of other, about 12 things that we follow everywhere we go. And you probably see that plaque on the wall if you walk around here enough in some of the offices. But that's the Andrews patient philosophy. And to be honest with you, most of that came from Dr. Houston, Frank McHugh, who was my mentor at the University of Virginia, who was the team physician up there, who was the epitome of a team physician, who I did a fellowship with, and then also from Professor Albert Triot in Lyon, France, who was a kingpin of knee surgery in Europe, and I learned the European methods from him in a fellowship. And then arthroscopy, my mentor was Dr. Lanny Johnson, who was the king of the arthroscopy for all those years in the United States, and he lived up in East Lansing, Michigan. Lanny Johnson, he was the best technician in the world with the arthroscope. He's retired now, but most of those things came from those mentors, and that's what we live by. We have to go back and nobody's perfect. Every day we make a mistake. We didn't take good care of this patient. We didn't do it just right. So you constantly have to go back with those little mistakes and what I call mend your fences.
Right.
And go back and take better care of them. We talked about failures. It's unfortunate in medicine, but doctors and paramedical personnel have a tendency to shy away from their failures. They don't want to call them. They know they're not doing well. They sort of push them away. They're hurt by it. And instead of embracing them and showing them more attention and calling them on the phone and seeing them more often, they see them less. And usually they wind up, they just go to another doctor. Mm-hmm. Whereas if you hang in there with them and embrace them and show more attention to them, you know what? You'll see them 60 years later, 50 years later, like I do, whatever, and they come up and hug you for taking good care of them. You remember, you didn't do a very good job, but they remember that you cared about them and you hung with them. And it's almost like you did a perfect job on them. They're so appreciative of you for taking care of them, even though it didn't work out well. That's what you have to do in medicine.
Yeah, those are great lessons. And I think another thing that you do really well is you offer reassurance. And the name and not the name drop, but the name that comes up is Drew Brees.
Oh, Lord.
Catastrophic injury, throwing shoulder, career's over. You could have walked in there and be doom and gloom, but instead you were able to offer reassurance. And he went on. I mean, look what he did after you were able to do your thing.
First thing he asked me when he woke up in recovery room, he was still half asleep. And he looked up at me and said, were you able, did you have to cut on me or could you do it arthroscopically? I said, we did it all arthroscopically, but we broke the record with the number of anchors we used in an arthroscopic procedure, but you're going to be fine. You're going to be able to play. Tell them something positive right away. You're going to be able to make a comeback and your shoulder is fixed, and we couldn't have fixed it any better, and that was true. But the main thing about Drew Brees, I'll have to tell you about him, and I have permission to mention him in things like this, is I have 2 or 3 what I call signature patients. And Drew Brees is one of those. And he's probably the most motivated patient I ever operated on. And his success in his career is completely attributable to his motivation and his work ethics. There's another signature patient like that had a tremendous career, and that's Roger Clemens. I did one of the first shoulder arthroscopies on him. That's how I got involved in the baseball shoulder, was through Roger. And he was the same way. Roger helped us develop all of our baseball throwing exercises, and he was our model. We call it the Throwers 10 program. We still use today. And by the way, I just operated on Roger's rotator cuff that he kept throwing spring practice down with the Houston Astros. He's still throwing off the mound in age. I won't tell you his age, but you probably can figure it out. I just operated on his shoulder, on his rotator cuff, complete tear the other day. So and I've operated on both of his sons, and he's a motivated patient, as motivated as anybody I've ever operated on. I have another signature patient that's like that too right now that fits into that mold, and that's Chase Young, who, as you know, was the #1 pick for my football team, the Washington. What do we call them nowadays? The Commanders?
Commanders.
I don't know. They're still the Redskins.
The commies, right? Come on.
So anyway, he had a terrible injury to his knee, and he's the same way. And we're still in a recovery phase with him. But these guys that work hard like that, they have bad injuries. They're motivated. They don't necessarily have to be athletes, but athletes are good examples. And they get well with things that other people can't get well with.
Right.
And as I said before, they make you look pretty good as a physician.
Yeah. Oh, yeah. One final thought, because we didn't talk about it, on sports specialization. So that's kind of the new thing. We look at MLB, though. There's a lot of players from the Dominican that are now, coming to Major League Baseball. And their story is from the time they're 5, when the sun comes up, they're playing baseball till the sun goes down. So they're playing a bunch of baseball. So now the argument is we want our kids playing multiple different sports, but then like these kids that are playing a ton of baseball sometimes get ahead. So like, how do you reconcile all these thoughts that the typical parent's going through right now?
Well, that's a myth about these kids from Japan, for example, or Dominican, Colombia, now Brazil, you name it, playing baseball. And they're so motivated that when they come here, they've been playing baseball all year long, accelerated at a young age. And if you look at them closely with their elbow or their shoulder, particularly their elbow, they already have arthritic components, spurring, but they're so motivated because they're coming out of a this is their way out.
Yeah.
And they're tough as hell. And they throw and they just play.
Right.
But their elbows are not virgin.
Right.
And when they finally do break down, it's later in their career because that's all they can do, and they play, and they don't complain. But I see them where their elbows are just trash, and they're throwing 100 miles an hour.
Right.
So don't think that they're not abusing their elbow at a young age. And for us to try to take our kids that are genetically not inclined like that and try to put the same workload on them, they'll be out before they get out of high school. They'll be out of baseball. So it's like apples and oranges, and it's a shame that we even think that that's the way to throw more, and they'll be better pitchers in the kids we have in the United States. The kids in the United States that can do that have genetically inclined, and usually their daddy was a major league pitcher.
Right.
And they can manage that heavy load. But we're talking about kids that when they're 14 years old and they weigh 90 pounds and they're loose jointed and they don't look like they're going to be baseball players, and they're trying to do that, they won't hold up. By the way, you got to be careful saying he doesn't look like a baseball player, but baseball players come in all sizes.
Right.
Some of the best throwers in the history of Major League Baseball were 160s, 170 pounds, 5'8". I've got one I operated on like that when Major Leagues years ago, threw 100 miles an hour. So you can't say, same way with golf, you can't say a certain body habit. But the trend now, though, to be honest with you, is to pick these kids that are 6'6", 6'7", 6'8". We even got one that's almost 7 feet tall. And they're all trying to pick these kids that are tall. They're actually basketball players playing baseball.
Right.
And so they're picking these kids because of Randy Johnson, and with the long stride, they take 8 feet off the mound to the home plate, and the batters are scared the hell out of them. They're throwing 100 miles an hour, like from here to that wall over there. That's what it looks like. And we had batters, for example. I've got one major league player for the Atlanta Braves was telling me about when he was playing for Atlanta, and they were playing Seattle with Randy Johnson. And it was his turn to bat because he was switching outfield with his partner, and his turn to play the outfield. They had to play against Randy Johnson. And he said he got up there and he took 4 swings at the ball on purpose, struck out.
Just to get out. Yeah.
Coach took him out of the game.
That's amazing.
But the problem I was getting to is that these kids have long wingspan. Arms are, down to their knees. And so they're putting a tremendous stress, throwing 100 miles an hour on their elbow, and they're all having elbow problems.
Yeah.
High incidence of Tommy John. But that's the trend now, where they're trying to pick those kids, and I'm sure you see that all over.
Oh, God, yeah.
And they come in, you think they're a lot of them are tall and thin and loose jointed too. They get tall like that, but they're injury prone. So that's a trend right now, but we're seeing a lot of injuries with it.
Well, beautiful. Well, you've got to go talk to patients that you operated on yesterday, and you got some big meetings today. We just appreciate your time. Number one, Dr. Anders. I mean, from Roger Clemens to where you're at today, man, oh man, what a journey. One thing we didn't get to ask you that I think I figured it out is, when you turn on the ESPN Sports Center and they say so-and-so went to see, they didn't go see the orthopedic surgeon, they went and saw James Andrews. And so that's something that
you've earned that.
Yeah, you've earned the right because you've carried yourself so well over the years, and you've got amazing people around you, and
let me tell you, things like that. You have to take your profession seriously, but you don't have to take your notoriety that serious. You can't. That doesn't do you any good. Notoriety is fleeting, and if you're not continually trying to be better, it won't last. And I have people through the years that will ask me the best advice I've ever gotten in my career about success. And I'll have to tell you, it came from my wife, Janelle. And when she says, if you're still talking about what you did yesterday, you're not doing much today. And I live by that. She'll probably hear this podcast, and when I get home tonight, she'll remind me of that little slogan. By the way, let me tell you one other story about my wife and how important your spouses are and what your goals are. One thing about goals, and you have to have goals to be successful, but if you just dream about goals and you don't write them down, if you just dream about success and you don't follow up with written down goals and actually perform your dreams will never help you. So one of the things that I've learned is try to get my goals in order. And it took me a long time to do this. The reason I'm mentioning this because I made the mistake when I was young with my family in the early days when I was working day and night all the time in sports medicine. I didn't pay attention to my young kids like I should have. So I finally figured out to get your goals in order, number one is your faith, number two is your family, and then number three is your profession. So I want to close with that order of getting your goals in order. And those of you that are out there, particularly young parents, remember those goals and take care of your young family and spend some time with them.
What an icon.
Yeah, beautiful. What a pleasure. Dr. Anders, thanks for sitting down with us. Yep, appreciate it.
Thank you.
All right, guys, have a great day.
They made me wear this now.
I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.